Nicotine has doubled in the past 2 years. According to research published in the New England Journal of Medicine, the rate of e-cigarette use among 8th, 10th, and 12th graders continued to climb in 2019. In fact, it doubled from 2017 to 2019. So far this year, 25% of 12th grade students said they vaped within the previous month. For 10th grade, it was 1 in 5 students, and 1 in 11 students in 8th grade said that they vaped within the previous month. The study looked at data from more than 42,000 students. And there are currently hundreds of cases of severe breathing illness right now, all said to be caused in part by vaping. Officials investigating the outbreak are looking at flavored e-cigarettes and counterfeit marijuana oils as 2 possible factors. Earlier this summer, the Food and Drug Administration opened a criminal investigation into the vaping supply chain. While they found common ground among the cases, they're still far from determining what the exact cause is. Officials believe that specific flavored particles in e-cigarettes can damage the lungs, airways, and blood vessels. They're also eyeing counterfeit versions of cannabis oil containing THC, the high-inducing part of marijuana. A Health and Human Services spokesperson says the agency knows how many patients used THC vapes. Not all states allow the sale of marijuana oils, so some of them are no doubt purchased on the black market and contain many unknown ingredients.
We know that people are adulterating the products very frequently. We know that people are putting additives in.
Adding to the problem, counterfeit THC oils are being packaged to look like legitimate regulated brands.
We know that vaping is harmful. We just don't know the full extent of all the harms quite yet. And we've seen e-cigarettes out on the market for the past few years, and we knew that there's lots of chemicals in them that aren't well regulated that could cause lung injury, and now we're seeing deaths from it.
2 brothers in Wisconsin are facing multiple felonies for running a large operation creating their own THC vaping cartridges.
There were 31,000 cartridges ready to get shipped out and tens of thousands more waiting to get filled.
Health officials have not found a direct link between the vaping illnesses and the Wisconsin brothers, but say their operation is evidence e-cigarette users need to be aware of what they're buying and what they're inhaling.
We just don't know. It could be the materials themselves. You could have some really bad impurities.
A pediatrician with the Washington chapter of the American Academy of Pediatrics says it's important to talk to your kids about vaping.
And because a lot of vaping equipment is so hard to detect, there is no smoke, there's no really a big odor that you can sort of detect, I would really encourage open discussion and communication.
And whether it's THC cartridges, strawberry oil, or tobacco vapes, users are urged to think twice about all the chemicals they're ingesting.
Inhaling chemicals into your lungs is never a good thing. Really, you should consider whether the risk is worth the potential benefit or pleasure you're getting out of them.
So the Centers for Disease Control and Prevention has activated its Emergency Operations Center, creating a central command post for investigating the illnesses. Health officials across the county are urging e-cig users to just stop using these devices until they figure out the source of the illness. They add the damage done by vaping is irreversible. And we have questions. We know that you have a lot of questions surrounding